thank you to both Dr. Harrell and Hannah for joining us today to present on this new tool that you have and kind of give your thoughts again on vaping as well. So Dr. Paul Harrell is an associate professor of pediatrics. He's a research leader at the Division of Community Health and Research at Old Dominion University. Prior to ODU, he completed fellowships at Johns Hopkins and Moffitt Cancer Center. He has published over 50 peer-reviewed manuscripts and has been awarded over $1 million in external funding. Presently, he serves as a principal investor on the National Cancer Institute and Virginia Foundation for Healthy Youth grants. And I'm sure you're very familiar with his work. He's such an advocate for tobacco and everything that we do here in tobacco prevention. And we also have Hannah Savage. She's a research assistant at the Department of Pediatrics in the Division of Community Health and Research. She's currently working on an MPH degree at Old Dominion University, and her prior work includes administrative work at the National Institute of Arthritis and Musculoskeletal Skin Diseases, and also the National Institute of Child Health and Human Development at the National Institutes of Health, as well as serving as a Peace Corps volunteer in rural Zambia. Am I saying that right? So Hannah, again, I think you probably all know her as well and her tremendous work that she is doing as well. So thank you both for joining us. And I'm going to turn it over to you, Dr. Harrell, to start your presentation. Thank you both so much again.
Well, thank you all so much. I'm so happy to be here. Really appreciate the opportunity. It's nice to see everybody, see some familiar names and some familiar faces. Was happy to write about my experiences in kindergarten and enjoyed playing tag and enjoyed seeing everybody's responses about that. And please, I'm continuing to look at the chat and see some about the responses in terms of things that you think teens need, and certainly around vaping prevention and cessation, and that's a big part of what we do here is being able to listen to what folks in the community are saying, and that's some about that we're going to present on today is about what we're hearing from people in the community and trying to bring that all together and kind of synthesize the information that we hear so that we can develop things to help it in the community, and help improve youth health. So I'm very excited to be here. So I'll go ahead and start my presentation. So can everyone see that all right? Great. Okay, so I am coming from the Macon and Joan Virginia Health Sciences at Old Dominion University. So I've been at Eastern Virginia Medical School since 2015, and then just in July 1st, we merged with Old Dominion University. So this is our new institution, Macon and Joan Virginia Health Sciences, and we are part of Old Dominion University. I'm still at Eastern Virginia Medical School. It's just now we have a wider group that we're with, and very excited about that. And so I'm very excited today to talk about this work that we've been doing and the tool that we're currently piloting. I just certainly want to take this time to recognize all the people that have helped with some of the research that I'll be talking about today. I'm very, very excited to be here. So first to start off, this is sort of the motivating factor for some of this work. We really want to try to bridge the gap between research that has found some great interventions and great evidence-based practices, and the actual practice in various settings. So we're today going to talk about educational settings, health settings, just a variety of different settings where these resources could be utilized. So it was great to hear and to see that many folks are using some of the resources out there, and we'll be talking some about these particular different resources. But we know in general that it takes a long time for research to actually affect practice. We see very low reports of different types of evidence-based practices actually being used in the field. So we want to try to help improve this. So this particular grant that we've been working on involved 3 aims. So we're now finishing up the 3rd year of it. So in the first year, we worked to understand different risk levels of youth. So looking at adolescents and trying to understand different risk levels that they might fall into, and also talking with youth serving professionals to understand what they're seeing out in the community. So in the first goal, we're trying to look at youth. Then in the second goal, try to understand different resources that are available, and understand perceptions of these resources, why or why not they may be being used within the community. And then in the third aim, we try to bring these things together. So connecting the youth with the resources that are available and helping to improve these connections out in the community. So for aim 1, the first thing, again, that we wanted to do was to understand youth within Virginia, and understand different risk levels that they may fall into. And so we did this first with a secondary data analysis of the Virginia Youth Survey. And then we followed up with this by getting feedback from our task force, as well as specific input sessions with youth serving professionals in interviews, as well as in focus groups. So first, to talk about the secondary data analysis. So we looked at data from the 2019 Virginia Youth Survey. So this is a survey that's done in collaboration with the Virginia Department of Health. And they survey youth in the state of Virginia. It's done in collaboration with the National Youth Risk Behavior Survey. But here in Virginia, it was done with over 4,000 youth throughout the state. And the survey is conducted in such a way that it can be weighted to represent the almost 400,000 high school students in the state of Virginia. So you see here different descriptions of the sample and the weighted sample as well. So you can see all the grades are represented in high school. We see also male and female, race, ethnicity, and sexual orientation. And so again, these are weighted to be representative of the state of Virginia. So we also wanted to look at substance use. So we were interested in certainly tobacco product use, but also looking at other substance use, because we know that the youth often that are using substances aren't just using one substance. And we certainly found that here as well. We found that most common substance that was used was alcohol. This was used by close to half of the sample. So a little over half, though, they said that they had never used alcohol. And then there was some that said that they had ever used in their lifetime, but hadn't used in the past 30 days. Then there were some that said that they had used in the past 30 days, so that they were current users, but they'd used less than 10 times in the past 30 days. And then we have regular users that had used 10 times or more in the past 30 days. And you can see that for e-cigarettes, that was about 9% of the sample, which translates to over 30,000 high school students that reported using regularly. So we also saw some use of marijuana. We saw cigarette smoking. Of course, we saw much less cigarette smoking than we have seen, like just a few decades ago. So, that certainly has been a success story that we've seen less cigarette smoking, but obviously, there's still a lot of work to do in terms of e-cigarette use, as well as certainly marijuana use and alcohol. So what we did was use these indicators to develop a using machine learning. We looked at different classes that youth would fall into in terms of their use of these 4 different substances. Um, so so we used fit statistics from the latent class analysis, so not to get too deep into it, but these statistics supported a 3-class solution, so 3 different groups of students. So the first largest class was about 60%, so about 6 in 10 students that they were very unlikely to report use of any of these 4 substances. So that's the majority of students. So that's certainly good news. Then the next class that we saw was almost 3 in 10, so over 1 in 4 students, about 28%. So these participants, these high school students, were unlikely to have ever smoked a cigarette, but they were likely to have tried other substances. And then finally, there was a regular user class. So this was about 1 in 10 students. So they were likely to be regular vapors, and also to use some other substances. And so I'll go into that in a little bit more detail in the next 3 slides. So this just shows the probabilities of use for never users. So these, they were very unlikely to have used to have vaped nicotine or have used marijuana. There was some chance that maybe they had tried using alcohol, but they were very unlikely to have used it currently, and extremely unlikely to have used it regularly. So again, this was about 6 in 10 of the students. Next, we had experimenters. So this was a little over 1 in 4 of the students. So they were more likely than not to have at least tried vaping nicotine. However, they were unlikely to have used it regularly. And again, with marijuana, they were likely to have at least tried it, but unlikely to be using it regularly. With alcohol, they were again likely to have tried it, but unlikely to be regular users. And they were unlikely to have ever tried smoking cigarettes. And then this was the more regular users. This was about 1 in 10 of the high school students. So they were very likely to be regular users of nicotine, so to have used more than 10 times in the past 30 days. And they were certainly, very likely to have tried it. And so you look at marijuana, they were also likely to be regular users. With alcohol, interestingly, they were still unlikely to be regular users. So we do see, and certainly that could be attributed to the addictive nature of e-cigarettes. The people that do use them tend to use them quite often. But so we saw more social use with alcohol, and then with cigarettes, we saw that they were more likely than not to have tried using them, but may not have been current or regular users. So these were the what we found with the data analysis, again, with this sort of machine learning type of technique. And so we use these to kind of develop some descriptions of youth within different risk profiles, so within these three classes. And then we kind of took these descriptions and talked to people, to professionals that were seeing youth, to try to develop some descriptive profiles based on what they're actually seeing. So Hannah now is going to talk some about that work, speaking with youth professionals.
Yes, thank you, Paul. So to help us guide us through this process and through this project, we convened an expert panel with members from different sectors, including clinical, educational, recreational, public health, and others, with an interest in improving how adolescent vaping and tobacco use is addressed. And you can see in our chart all the different expertise and perspectives we had on our panel that will help guide us through this project. And they also helped us to define adolescent risks for vaping during our meetings. It was very helpful to have that expertise. Next slide. And so with our task force, we started an iterative process of refining the vignettes, the descriptions of the different teens based on those three risk profiles. We worked with them, going back and forth to get have more inclusive names, to include behaviors that might be seen in these different teens at the particular risk levels. And to also include references to influences that they might encounter, such as peers or social media, that and the different ways that they would interact with these devices in different situations. We were trying to make these descriptions as lifelike as possible. And so for the three risks levels that we came up with, the never user, and this person was, had never used any tobacco products, but was maybe susceptible to influence, maybe because they're young or because they're trying to fit in, but might have some exposure to their peers vaping in bathrooms and in the schools, in the social situations. And then the next risk level was the experimenter. And this person has had more experience with vaping, maybe once or month with friends, usually with social situations with other substances present. And they're not really seeing the harms of vaping yet. They're just seeing more influences on social media and through their social influences that vaping is cool and not hard, is safe, and you can do different things, and that's more appealing to that social situation. But it might be trying to hide from their mother or from their adults in their lives, trying to get away with it, but maybe still need some intervention at that point. And then we have the regular user who has maybe gotten caught with a vaping device once or twice, and is trying to get help for it, but he still vapes because it makes him feel calmer, and is showing a little bit more signs of dependence because when he tries to stop, he has trouble concentrating, and also might be using other substances as well. So that he might need more, someone on that level might need more, cessation and addiction counseling that's more direct. Next slide. And so we took those vignettes and we held input sessions with healthcare and educational professionals just to help refine them. And we got, a broad list of different people to talk to, as seen in our chart, physician assistants and teachers and school nurses, counselors. And in these input sessions, we they characterize their perceptions of risks associated with vaping, and what resources they think they need to help remedy the situation with teens vaping. And with it throughout our conversations with them, we thought that healthcare and educational professionals were in an ideal position to intervene when they encounter adolescents who vape in their workplace. Next slide. So some of the methods and procedures that we use to conduct these input sessions, we recruited professionals who regularly work with teens. Here's another breakdown of the different people we talked to. And we collected data through interviews and focus groups conducted on via Zoom because it was still during the pandemic. And we discussed with them their current available resources, when, how, where vaping should be addressed in their opinion. And then we saw input about the different vignettes and how to make them more realistic to what they're seeing in their work or in their workplace, in their work with teens, and refine them further. And then in talking and analyzing these discussions, we were seeing several recurring themes, such as risk factors for vaping, accuracy of the vignettes, the interventions for vaping that were currently being used in the different professional settings, and then also what resources are required to intervene for at-risk teens. Next slide. So when we were talking to some healthcare professionals, we were talking about vaping initiation, and they thought that some of the influencing factors could be peer pressure, personality traits, age of the teen, and other things like family use or home environment, as seen in our chart over here. And then through our discussions, there seemed to be a feedback loop between the risk factors and the vaping behavior, where the risk factors would influence more of the vaping behavior, but then the vaping behavior would also create better or higher risk factors. Next slide. And then we also talked to healthcare professionals about the different resources they think are needed for prevention or intervention. And they thought highly of education for both preventing a teen from starting with vaping and also intervening as well for someone who's already vaping. But for prevention, they also thought that having a supportive environment and some social strategies for having to counteract peer pressure were some key interventions or ways to prevent teens from starting with vaping. And then for interventions, they mentioned medical interventions like I guess NRT or whatever might be available for teens of that age, as well as motivational interviewing to gauge motivations to quit or attitudes around vaping, as well as some other like mentorships or mental health interventions were also mentioned as well. Next slide. And in the educational environment, high school and middle school students were seen to have found different ways to bring these devices into the educational environment, causing lots of disruption and challenges around disciplining or intervening. And when talking to some of these professionals, like teachers and school nurses, they thought that some of the more prevalent factors to identify a teen that's at risk of vaping was the teen's peer group, whether or not the peers are also engaged in this vaping behavior. They also recognize some other risk factors, such as lack of a friend group, peer pressure, polysubstance use, and their home life. And some of the more the reported interventions that were used most often in schools were confiscation and suspension, so more of the punitive measures. But they also thought that having education and therapeutic interventions was necessary to intervene with vaping. Next slide. So I'm gonna hand it back over to Paul.
All right, so thank you, Hannah. So next we were again trying to understand more about resources that are available. So we sort of started getting a feel for this, but we really wanted to begin to map these available resources to the risk tiers that we had identified before, and really gather a comprehensive list of materials that were out there. And then assess stakeholder perceptions of the resources through both interviews and surveys. So this was an initial development of a flow chart for helping to map different resources to the risk tiers that we had developed. So, just looking at if they had any history of use. If not, then they would be provided with prevention resources. And then looking to see if they were using on a regular basis or not. So whether they would need more sort of intermediate resources or more specific addiction cessation resources. So, and to help flesh this out, we put together descriptions, again, matched with the risk tiers. So this initial one talks about a never user, and talks about a prevention initiative that could be provided within the school setting. So this is based on an actual intervention with some, some evidence behind it, and that is currently used within schools. So it would involve these weekly sessions that could be accessed on a desktop computer, where they recommended using it in the classroom during lesson periods. So this second one was for experimenters. So gave an example of Jasmine as an experimenter, and then talked about an alternative to suspension program. This is one that's been developed by the American Lung Association. And really, we just wanted to understand, we wanted to get feedback about, what they thought about the potential of using this resource, whether they thought, was it acceptable, appropriate, and feasible. And I'll talk more about those different constructs on a later slide. So this was for the experimenters, and then this is for the regular users. So again, sort of talked about this particular student having some issues with nicotine vaping, and then trying this text messaging cessation program. So again, we just wanted to understand what youth surfing professionals thought about the potential of using this program. And again, this is an evidence-based program from the Truth Initiative. So we had a variety of participants that were involved in these stakeholder interviews. So we had administrators, school counselors, psychologists, school nurses, teachers, and then representatives from various community organizations. So just having a wide, diverse perspective to help us understand a variety of perspectives on these different resources. So in general, we found that disciplinary resources were used most often. Some of the stakeholders said that there really weren't any resources available. And then some did talk about some various resources that they had some experience using. So these are some of the key quotes from the professionals. So some of them, again, talking about not really having any resources, maybe just some pamphlets that were available, talking about, that they might be partnering with different organizations, that they may have things that they use within their curriculum. And And then talking about different discipline practices. So this school administrator indicated that typically they would be suspended for a day, and then they could come back. If they had a second offense, they would be recommended to a substance abuse prevention program. But oftentimes there was a long wait list for this, and before they could get into the program, they would be caught again. And then oftentimes that could involve suspension or expulsion. So really some difficulties there in terms of not being able to connect youth with resources. So there's some other barriers and concerns that were mentioned regarding the various vaping prevention and cessation programs. So mentioned concerns about incentivization to complete, so concerns that the youth wouldn't be motivated to complete the program, issues with integrating with the curriculum, feeling like the intervention was insufficient, issues with phone or internet access, length of the intervention, concerns about getting parental consent, issues with school board approval, concerns about peer influence, and issues with language, such as not having the resources available in Spanish. So we then, or concurrently, we conducted some surveys with teens, parents, and professionals. So we're currently analyzing some of this survey data, but we do have some preliminary examination of responses. So when we're conducting this survey, we looked to implementation science research that is available, and so these factors are often examined within implementation science literature. So we conducted surveys assessing these different ways of looking at resources. So first was acceptability. So this is the perception among stakeholders that a resource is generally agreeable, generally satisfactory. Next, we looked at appropriateness. So then this is questioning whether the resource is a good fit for a particular practice setting, provider, or consumer. And then finally, feasibility. So even if something is acceptable and appropriate, it's a question as to whether the resource can be successfully used or carried out within a given setting. So we wanted to expand the resources that we were looking at. So this was, again, for never users. We asked questions to stakeholders. So again, this was teens, parents, and professionals about these different resources. So first asking about the Aspire intervention that I mentioned previously, and then also asking about Behind the Haze. So again, we wanted to give real world examples to get their perceptions about what is available out there and how that may or may not be useful to them within their setting. So next, for experimenters, we looked again at the in-depth program. We also asked questions about the Live Vape Free intervention, so as a professional support and expert advice, as well as text messaging for cessation. And I know now this program has we have resources now in a different location with Live Vape Free VA. So this was what we initially looked at for both adults and for teens. And then for regular users, we both looked at the Truth Initiative's This Is Quitting program, as well as asking about the possibility of substance use counseling. So again, we provide these two different resource options and then look at their perceptions of the different options. So what we found was that parents and professionals in general felt that the Live Vape Free support and text messaging was more feasible than the program that would involve in-person sessions conducted at the school, as the in-depth program by the American Lung Association uses. So so this sort of makes sense. So both parents and professionals, we found a statistically significant difference in terms of their rating of feasibility. So then we also looked at, we also found some significant differences in terms of teens. So they felt that the text messaging program was more appropriate than the in-school sessions. And they also felt that the truth text messaging was more acceptable and appropriate than substance use counseling. So these are some things that we're going to continue to dig into and that help us learn, about what may be different barriers or different beliefs about these different resources. So we also looked at some responses to an open response question on the survey. So here, teens, parents, and professionals were asked about what information and or support do they think that teens need to avoid vaping. And so again, we found that education was one of the most common responses. So you see from a parent mentioning that they didn't believe that teens knew about harmful effects from specifically from nicotine vaping. They also talked about family support, getting peer support, safe avenues of communication, having skills to resist peer pressure. So you did see some discussion of social media outreach, although interestingly, that was more by parents and professionals and not so much by teens. And then also some discussions of firsthand accounts. So just having teens report about their experience getting away from vaping nicotine. So these were different responses that they indicated would be helpful. So I'm now going to pass it on to Hannah to talk about some of the work we've been doing to try to develop something to connect teens with various resources that are available.
Great, thank you, Paul. So yes, in our third aim of our grant, our final year or so, we published the website and are now piloting it to make quality improvements. Right now we're trying to talk with at least 15 people, but we're trying to get maybe a couple more, especially as the schools come back into session and the teachers and school nurses have teens in their schools again. We want to try to talk to some of those folks again. And then after we finish the pilot, hopefully soon, we'll refine and then disseminate to partners using, we'll have like booklets, like a PDF version of the tool, as well as QR codes that will link to the website as well. Next slide. So now I'm going to talk about our tool that we've been working on, the culmination of all the research we've done over the past couple of years. This is the Assessing Vaping Exposures for Teens, AVERT as for our acronym. And it's just a guide or a assessment and connection tool to link adults and also teens to different resources. Next slide. So I'm just going to go overview of the website since we are still piloting and we're going to still make some changes. But the website includes an online assessment for adults who maybe have teens that they're worried about, maybe like a class of teens, or maybe they have some clients that they're working with that they need to find some resources to use with them real quick. And then we also, we also have another assessment for teens who find their way onto the website as well. If they're looking for resources on their own, what kind of resources that would fit for them based on their risk level. And then we also have a downloadable printable version of the tool as well for those who live in maybe rural areas that don't have reliable access to internet, or maybe work in a field that doesn't usually have access to computers. So we want to make sure the tool is accessible in different situations. Next slide. So again, just giving the brief overview of some of the features of the website. We'll have different choices for the people who come on and are looking for resources. For adults, we have a short assessment for what kind of healthcare professional they are, and then what kind of resources they're looking for, if they're looking for prevention or intervention or addiction counseling type of resources. And then we also have the teen assessment, just a brief show of it. And again, very quick questions just to kind of get to what kind of level they're on, level 1 or level 2, or more intensive interventions. And hopefully it's not, it's quick and won't take too long for them to get through it. Next slide. And after filling out those assessments, they'll come to one of these 3 lists of resources. We have them, level 1, level 2, level 3, based on the classes that we had talked about earlier. And we have a list of resources that are linked to based on that level, and then they can go back and forth if they're curious about what's on some of these other lists as well. And then next, and then they can figure out what they need for themselves. Next slide. And then also, this is kind of just an overview of what the PDF has. Again, we have an assessment page to help them figure out what level is they're on in terms of their vaping needs, and then that will link them to the appropriate section, and it's color coordinated. But the list of resources are the same as what's found online. It's just in a way that you can get to it or look at it without the use of a computer. Next slide. And so, as I said, we were piloting, in the midst of piloting this Avert tool. We've already talked about 15 different people, of different organizations, and we're trying to maybe talk to a couple more, especially teachers now, and maybe some school nurses now that teens are back in school. And afterwards, we'll make some quality improvements, and then we'll be able to distribute the tool more broadly for more for use. Next slide.
All right, so thanks, Hannah. So I want to take this time definitely to thank all the folks that have been involved with this project, task force, the different stakeholders, different students that have come through, and certainly want to thank the Virginia Foundation for Healthy Youth for their support of the program. Yeah, and I'm happy to take any questions. Thank you.
Well, Hannah, thank you so much for going through your research and explaining, what you guys have done. I know some of the viewers here have seen you guys present on Rethink Vape, so just seeing the continuation of your work is really helpful. And I want to go back to the question we asked at the beginning, what do you think teens need for vaping prevention or cessation? And some people in the chat answered, they talked about, education, really knowing the facts. And that kind of goes with, it was slide 34. I had to go back. You asked people about what they think too, what information do they need and support. And it kind of lines up the same thing. I know one of the top in your interviews, they said education, family support, peer support, and someone in the chat talked about, skills to for coping with like stress, anxiety, and cravings. I think that goes along with that support. And also, I think the fourth most thing mentioned in your interviews was a safe way of communication. And I think that's important too, make sure the teens and youth have that, in order to get the education they need, right? And know that it's not just, the nicotine in it. It's not just flavoring. There's also other, ingredients and chemicals that, affect them that's in vapes. So that's what I got. I might have missed someone else, but it was interesting to see what the viewers think also align with your interviews and, questioning people too. So along that, I know that we have data, and sometimes data is kind of old and things always change, right? So we had a question about vape usage. We see the data, it's decreased. However, you guys have been interviewing people, especially in schools. What's your perception of vaping usage? Has it gone down? Is it kind of consistent? And, it could change too from interview to interview I know you've interviewed people from around Virginia, so it could be different from Northern Virginia versus down here too. So what do you guys think about vaping usage and how the trends are realistically, I guess?
Yeah, that's a great question, because it has been interesting that, based on data, it does seem like, since COVID, there had been a reduction, as kids were, kind of stuck at home. Although I have seen some, reports that it's kind of like a bimodal kind of thing, so that for some kids, they were, as they were isolated, they were less likely to use, but for some other kids, especially those that had already started using, they may actually see an increase in their use as they're, isolated and stressed out. um, yeah, and then, talking with professionals, we're definitely hearing a lot that they say that this is a major concern, that they're seeing it in the bathrooms, and and throughout the school, and that kids are even, talking about it, that it is an issue that they're having, that they're having difficulty with it. So yeah, so they're and of course, with the data, we're always sort of looking backwards. So it may be the case that now, there is more use, but we're just not seeing it yet in the data. It may take a while for us to see that, if it has kind of rebounded. Um, but for that, we'll just kind of have to wait and see. But yeah, it's definitely something that we're continuing to monitor and pay attention to.
The resources will also change and kind of develop through that as well. And as we've seen, just the past 5 years, that the tobacco scene, it's ever evolving, ever changing. And just as e-cigarettes, up and coming, we see kind of an increase of these nicotine pouches. Zyn, in Norfolk, they always have the Harbor Fest. And so I went this year, and Zyn had this huge display. I don't know if you guys went, but right in like the middle of the whole like festival, there was like a trailer, and it had Zyn all big, and I think they might have also been like a sponsor. And just seeing them, especially, on social media, they show, these nicotine pouches too. And in your interviews with people, have they mentioned nicotine pouches, or maybe it's not really in youth, or maybe it's like young adults, or what have you guys seen? And Anne's on here too. She didn't present, but she's also on the research team too. So for those of you wondering, thanks, Anne, for joining us. So yeah, let us know if, what you guys think or have heard about nicotine patches and the usage in the community.
Yeah, so it's definitely been something that that people have been warning about, and that there's been concern about. There seems to have been some marketing campaigns. Um, we haven't yet seen a lot of youth use, but again, we may be behind on that. And I haven't heard so much about
Yeah.
professionals talking about it. Of course, it is, relatively easy for kids to hide. Um, so that certainly is a concern. Um, but yeah, we always have to to keep vigilant and um, keep aware of different things that are out there. Um, I know, with smokeless tobacco like chew, that was usually seen more in rural areas. not so much in urban areas, and often a lot of times linked with sports, particularly with baseball, at least traditionally had been kind of the story. So, but we're still sort of waiting and seeing as far as the nicotine pouches. But yeah, that's definitely something we're on the lookout for.
And then we just had one more question that came in. In your review of available resources, have you seen anything specific to smokeless tobacco?
Yeah, so I know there is some work that's been done. I'm trying to remember the name of they had, specifically related to kind of to teens and young adults that were again in more rural areas, that were more kind of fans of country music and that kind of
Mm-hmm.
thing.
It might
Um,
have been the same organization that does Behind the Haze. I know
Yeah,
they have another one that's more so for like smokeless. So it
there's like
might have
real
been,
cost or something like that.
yeah,
Yeah.
something like that. So. All right. Well, I don't see any more questions. I think that came in, and I know we're almost at time. So, thank you guys again, Hannah and Paul, for going over all this. And, I'm excited to see this tool used, later on once you finalize it. And I'm sure all of us would be interested definitely to utilize it. So I'll pass this on to Gina to close this up.
Thank you, Nicole, and thank you, Paul and Hannah. Amazing research. I love the way you broke down the different groups because everybody is so individualistic, right?
Yeah.
There's so many different avenues that why people use vapes, how people use vapes, how they hear about them, how they're initiated into that. It's really interesting how you did that, and I think it really will help in how to provide the support for that. So we are excited to kind of really promote this new tool on our website, Vape Free Virginia, vapefreeva.org, and definitely let us know when that's up, because I think this will be a really great resource for teachers, for teens, for professionals. And I really love the way you heard from the professionals and the providers. There's such a great voice for what we're doing because they see the parents, they see the teens, and they can provide this information, at least yearly, because most teens go yearly to their pediatrician. So I think their voice was very important with this. Another thing that I took away from it too was, and I love that you brought teens into the whole conversation as well. And what scored very highly for teens was text messaging, right? They needed education and they liked the text messaging about, how to do that. So I think that as we're developing ways to really reach teens with cessation, I think that has to be a critical way that we do that. So I appreciate that. So thank you very much for this great presentation, and we look forward to, once it's being finalized, to hear more about it and put it on our website. So thank you so much, both of you. I do want to invite everyone to join us back here September 17th. For our next Tobacco Free Tuesday. We will be learning about success stories from King George County Parks and Rec, and also Lexington at Kendall. That's the retirement community, and how they both went tobacco free. So one thing we are really excited about here at the Tobacco Control Program is really getting spaces and places tobacco free. I was sharing with Paul and Hannah, and kudos if Kyle, you're still on the webinar. Kyle has put together a Virginia higher education dashboard that details every college and university, public and private, in Virginia, and how they score with their tobacco policies. So if you're out there in a community and want to work with us on one of those colleges, please reach out to us. We would love to kind of work with you to, and I think Kyle just put it maybe in the chat, that showcases all of our colleges. So it's really interesting. Each college has its own report card. So we'd be happy to work with you. So everyone enjoy. I think that's all the housekeeping things I had to do. I think, correct me if I'm wrong, but enjoy the last few weeks of summer. We will be back here September 17th, right before we turn into fall. So enjoy, get outside, and have a wonderful week. Bye, everyone.